Are you dealing with nagging neck pain? Does it feel like you can't turn your head to the side or look up all the way? The pain's throbbing, it's aching, and sometimes sharp. You could be dealing with a variety of common orthopedic conditions that we're going to go into depth on today to help you better understand what you're dealing with and what you should do about it. Up to 70% of adults will deal with neck pain that interferes with their ability to perform daily activities at some point in their lifetime. If this happens to you, will you know what to do and how to deal with it? Today, we plan on deep diving into the world of neck pain. First, we'll cover the anatomy of the neck, or what you may often hear referred to as the cervical region. From there, we'll discuss common causes of neck pain and their associated symptoms. Now, these may vary from person to person, and some symptoms will overlap within a few different diagnoses, but they do typically have some telltale signs. Depending on the type of symptoms you have and the mechanism of the injury, who you should initiate contact with in the healthcare field will vary based on your own individual circumstance. Now, we'll finish up with what the evaluation and treatment of neck pain will focus on in a physical therapy setting. We're going to have further videos that go into even more depth of all the different individual injuries we'll cover today and their associated pathologies of the neck, but today, let's just cover the basics. The cervical region of the spine is what we're typically referring to when we discuss the neck. Now, the spine is divided into 4 regions: the cervical, thoracic, lumbar, and sacral regions. There are 7 vertebrae that make up the cervical region, 12 in the thoracic, and 5 in the lumbar. These vertebrae are individual bones stacked on top of one another with a slight curve throughout the spine, and it looks similar to the shape of an S. The sacral region is made up of 5 bones and a coccyx, or your tailbone. Now, these bones are all fused together as one. These vertebrae are all held together with ligaments. Ligaments connect bones to other bones, and they play a large role in stability, either when we're at rest or with movements. In between the vertebrae are discs. These discs have a thick outer layer and a gelatinous substance inside of them. They are there to provide space in between each of the vertebrae, and this allows for more mobility in all directions. In addition, they also play a large role as a shock absorber, acting as a cushion throughout the spine. Running up through the length of the spine is a space called the vertebral canal, or spinal column. This is where our spinal cord runs, and the spinal cord is a bundle of nerves responsible for providing motor and sensory function to all of the regions of our body. At every level of the spinal column, in between the vertebrae, a nerve exits the spinal cord on each side, and these are called nerve roots. These nerve roots travel to specific areas of the body on each side and have a region called a dermatome or a myotome that they are responsible for providing different functions at. Muscles are another prevalent structure in the neck and throughout the spine. These muscles are responsible for producing and controlling movements, as well as helping to maintain just positions of sitting, standing, and keeping our head and body upright against gravity all day long. Now, there's numerous muscles and numerous layers of muscles throughout this region, but you can think of them as 2 different types in this easy way. We have deeper layers of muscles that their primary job is to help provide stability all day long for us, and they do it without us consciously thinking about it. Similar to how our diaphragm controls breathing without us actively telling the diaphragm to contract every few seconds. Our more superficial muscles, or think about the ones that you can see when you look in the mirror, they play a larger role in movement, allowing us to look up and down, rotate side to side, and bend each direction. When we're experiencing pain from an injury, we can have a difficult time differentiating the roles and responsibilities of these muscles, and we need to retrain them with physical therapy through exercise. There are many different parts and pieces to the neck, and while some of them share similar qualities and presentations with regards to the pain and mechanisms of injury, they often do have some specific characteristics. It's also important to note that in many incidents, you may actually have more than one thing going on, Or one issue may be exacerbating another smaller issue that you didn't even know you had there. A healthcare professional can help determine what is the primary concern or the primary injury, and what is a secondary problem that may be present as well. Let's talk about several common injuries to the cervical area. Now, this certainly is not an exhaustive list, but it will cover some common orthopedic injuries in this area. First, the bones themselves can become injured in the sense of a fracture or arthritis. A fracture is a break of the bone, and in the cervical region, it's typically brought on by high force trauma to that area. These are seen with things such as falls from a high distance, car accidents, or direct impact from something. Because of this high level of force, there's typically a significant amount of pain and loss of function associated with it. This would require more immediate medical imaging, such as an X-ray, to confirm the injury and determine what's the best plan of care moving forward. Osteoarthritis, commonly regarded as the natural wear and tear that takes place on our bones and joints, is another injury to the cervical spine. We're all going to experience it to some degree throughout our entire body, but you may be more prone to experiencing it in the neck if you perform work or leisure activities requiring prolonged positioning or repeated motions in a specific manner that may accelerate this wear and tear. Keep in mind, the degree of arthritis is not always consistent with the levels of pain that someone is or is not experiencing. These symptoms are typically experienced locally to the site of the arthritis, and they can be dull and aching, but they can also have an occasional sharpness to them when you get into certain positions or movements. As we look at the disc, you may hear the term degenerative disc disease. This is due to a similar progressive process of arthritis, but instead it's taking place in the disc, and that disc is losing some of its fullness or thickness, and that leads to a decreased amount of space in between the vertebrae. Now, when we take away that space, this leads to a reduced range of motion and can also cause pain, as some surfaces of the neck may begin to have more contact and friction than what they would normally occur. A herniated disc is another common injury sustained within the cervical spine. This refers to when a portion of the disc has experienced trauma and is now beginning to protrude out beyond its normal boundaries. When this occurs, it can protrude into an area of the spine where other nerves are present. And when this happens, it can cause a variety of symptoms. And these symptoms may range from numbness, burning, tingling, even a loss of strength. This may be experienced locally at the neck or the site of the injury, or it could even radiate down the arm and extend all the way into the hands and fingers. Different nerves and levels of the spine will correspond to different regions of the upper extremity that you may be experiencing these symptoms. And this can help diagnose the suspected area of injury upon examination if an MRI has not already occurred. Finally, muscles can be a source of pain and injury as well. You may be experiencing a muscle spasm or a muscle strain. These can range from very mild to very severe with regards to the level of pain that you're experiencing, and it's often going to be accompanied with a loss of range of motion, and the level of pain that you're in will most likely influence how strong or how much function you feel like you have in that area as well. Muscle spasms and strains can be caused by prolonged positioning, a quick and unexpected movement, performing new activities, or even performing old or regular activities, but at an intensity or frequency that you're not currently accustomed to doing. Many neck injuries can be treated with conservative measures, but if you're experiencing numbness, loss of strength, severe levels of pain, or have sustained an injury from a fall or high level of impact, it's best to contact a physician and rule out any injury that may require immediate attention or medical imaging. Also, if you're experiencing significant headaches, dizziness, changes in vision, hearing, speech, or other disturbances, contact your physician and see if any medical attention needs to be provided and get a comprehensive examination prior to pursuing physical therapy treatment. When you arrive to Rehab to Perform for physical therapy on your initial evaluation, you should expect to do a variety of things on that first visit. First, your PT will sit down with you and take an extensive history of what's been going on. It's been shown that the majority of injuries can be accurately diagnosed by performing a thorough subjective history. Now, this basically functions as a question and answer session. The PT will want to know when and how your symptoms started. They're going to dig a little bit deeper into regards to the description of the symptoms, the location you're experiencing them, what makes them better, what makes them worse, and in general, how have they been trending since the onset of the injury? Is it getting better, worse, or staying the same? In addition, they'll inquire about your past medical history and see if there are any other previous injuries or medical conditions that may influence what you're currently dealing with. Now, if you have not seen a physician and you're describing things that would warrant further medical attention beyond physical therapy, your PT will recommend a referral to whomever the most appropriate person to see is. This may be your family physician. It could be an orthopedic, a neurologist, or a variety of other medical specialists to gain a more comprehensive look at your plan of care before progressing forward with PT. Lastly, they'll ask you questions regarding your daily life, hobbies, and work demands. This will help them gain a better appreciation of what may be contributing to your symptoms, what factors are in your control or out of your control, and what recommendations they have on modifying activities to allow you to adequately rest and recover when needed. The answers to these questions will provide your PT with a good idea of what the most likely cause of your pain is prior to moving into the objective portion of the exam. The objective portion of the exam is when they'll begin testing to rule in and rule out different causes of your injury or potential sources of your pain. In addition, this will allow them to get a baseline measurement of what you're currently capable of doing from both a performance and a tolerance standpoint. Based on knowing what you're currently capable of doing, what you need to be able to do for daily living, and what's preventing you from doing these things, that will allow them to develop an appropriate plan of care that's specific to your individual needs. During this section, you're going to be performing range of motion and flexibility tests, strength testing, general fitness measures, and specific diagnostic tests to isolate the area of interest. By the end of this section, they'll be able to have a better understanding of what's limiting your range of motion, strength, and overall tolerance activities. It's common to find pain and inflammation as a limiting factor. Structural limitations to the bone, disc, joints of the neck may be involved, muscular tightness, muscular weakness, and limitations with regards to neural tension or sensitivity. These findings will allow them to design a plan of care with an appropriate mix of modalities, manual intervention, stretching, strength training, general exercise, and even recommendations regarding activity modifications to help keep you as active as possible, but in a safe manner. Your treatment in PT will be largely dependent on the findings from your exam. There will be similarities between different patients' treatment sessions, but don't try to compare your experience to someone else's or mistake what someone else is doing as something that you should or should not be performing. If you have any questions or concerns, please ask your PT and they'll be more than happy to answer why something is or is not included in your program. When it comes to pain management and trying to calm down symptoms, it's common to be educated on the utilization of ice, heat, and other modalities or manual interventions such as electrical stimulation, dry needling, soft tissue mobilization or massage, and joint mobilizations. All of these serve a purpose in a plan of care with restoring appropriate levels of sensitivity and normalizing pain responses, reducing muscular tension, and optimizing intervertebral motion, which is simply how one segment of the spine moves on another. For some individuals intolerant to exercise, these may serve as a great starting point. However, the goal is to get you back up and moving again, pain-free, and not be dependent on your PT to feel good. As you progress through your plan of care, you'll notice less time being spent performing and discussing these areas and more time focused on exercising. The beauty of exercise is that it has also been shown to reduce pain when done appropriately, which is why it's imperative to find ways to get a patient moving early and often in their treatment regimen. Exercise will be divided into two main categories. One section will be focused on getting the injured area moving again. These tend to be more focused and more isolated stretches and strengthening activities of the neck, upper back, and shoulder regions. The other section is geared towards getting the patient active and moving as much as possible without exacerbation of their symptoms. Now, this section, this just looks like more traditional total body training and exercise. The whole purpose of this is to allow the patient to gain confidence with activities of daily living, work-related tasks, and start to live a normal life again. It also helps the patient recuperate any effects of deconditioning, which is just a loss of physical fitness levels from the pain that may have caused them to be more sedentary than usual or desired. Keep in mind that a large part of your success is not only what you accomplish in the clinic, but also outside of your time in physical therapy. Your PT will provide you with simple, effective, and easy to implement activities as part of a home exercise routine to ensure progression is taking place in between sessions as well, and that we are not moving in the wrong direction. A skilled PT will be able to find the right recipe of pain relief interventions and physical activity to allow you to get back to doing what you enjoy. Odds are at some point in your life, you will fall victim to neck pain in some form or fashion. When it happens, be sure to pay attention to how and when it started, the quality of the symptoms you're experiencing, and do not delay getting in touch with a medical provider to determine what the best plan of care is for you. Hopefully this video answered some general questions, and be sure to check out our other videos that feature specific exercises and stretches for neck pain.